My name is Karomo Ndirangu, a specialist in endometriosis and women period pain management. Long periods, heavy periods, painful periods, persistent pelvic pain, persistent pelvic pressure are not normal part of a woman period. Yes, they are not normal. These 4 signs or symptoms are the 4 major signs of the commonly known women pain diseases, broadly described as endometriosis, adenomyosis, fibroids, and ovarian cysts. Other symptoms of these diseases are failure to get pregnant, nausea, bloating, pain during sex, pain during urination, pain during pooing or haja kubwa. You can also have migraines. You can have irritation. You can have irritation and depression. You can also have a lot of tiredness, fatigue. You can have lots of aches, the body aching throughout every part of the body. Now, the question is, why do these diseases cause so much pain, so much discomfort, so much stress? The answer is 1, inflammation. Inflammation causes all these symptoms. But what causes this inflammation? It is the growing of tumors and implants inside the uterus and outside the uterus. These tumors or implants cause a lot of pain. By far, the most difficult of these diseases to diagnose and manage is endometriosis. In short, endo. Endo in short. Why do I say so? Because endo is very mysterious and peculiar. This disease originates from the uterus. In fact, these small tumors and implants are part of the uterus. They broke away from the uterus. It is not clearly understood how these pieces of uterus break away from it and move to many other different parts of the body, even outside the pelvic area. Very many different parts where they don't die. They attach themselves and continue to grow. The problem here is this. Once they leave the uterus, they continue to behave as if they are still part of the mother uterus. They continue to behave as if they are a part of the mother uterus. What happens is this. during the monthly period when the uterus is bleeding, which is natural and normal, they also bleed and release blood wherever they are outside the uterus. The problem here is this. This blood has nowhere to go. It is trapped inside your muscles. That is why it causes a lot of pain. It is trapped there. It can't move out. So even when your uterus finishes its work of shedding the blood in your muscles are still paining because they are still trapped there. That is the most difficult part of it. Now, there is another reason why it is very difficult to know where this disease is. It is this. Sometimes these breakaway tumors or implants are so small that it is practically impossible sometimes to see them. I'm not saying they are always small, but many times they are small. And even if they are small, they will still continue to bring problems. Whether small or big, they produce the same kind of problems. This becomes even more difficult if you happen to have all these diseases together at the same time. What I'm saying is that you can have all these diseases, endometriosis, fibroids, and cysts at the same time. It happens, but it does not happen all the time. If this happens, it will be relatively easy for the doctors to know that you have adenomyosis or fibroids and cysts. But it will take time, maybe even years, before they realize that you also have endometriosis. So when the surgeon does his work or her work to remove surgically this other growth, he or she will leave endo pieces there because he or she does not know that you also have them. That creates a big problem because you go home after treatment, and after some time you start getting the same pain because endo was not treated. Ladies and gentlemen, at the Gidi Center, we are one giant step ahead of the others, and we know better than that. In 2014, we made a major discovery. We discovered that these diseases, the fall of them, the diseases we are discussing, endometriosis, adenomyosis, fibroids, and cysts, they are like branches of one large tree. This means that they share the same roots, the same underlying cause. When we discovered this, we also discovered another thing, that the scientists and the doctors who have been looking for a cure have been doing so facing the wrong direction. The medicines they have been using to treat this were only trying to balance the hormones. But they did not try to go deeper and deal with the main problem, because balancing the hormones did not tackle what had brought about that
imbalance?
In 2020, we made our first medicine. And the same year, in November, to be more specific, we met this lady known as Helen. Helen had a very severe form of endometriosis and ovarian cysts. Her pain was such that over-the-counter painkillers and even prescription medicines, painkillers, could not control her pain, and she had to rely on injections. Her bleeding was such that she bled for 3 weeks every month. She was so thin, fragile, that the doctors feared for her life and decided that the only way to save her life was to have her uterus and her ovaries removed completely. And they did not get to that because we arrived just then. We talked to her and gave her our medicine. And believe me or not, in 1 month, she had no symptoms. She had no signs. And up to now, 6 years later, Helen is still fine. Almost immediately, we met this other girl. We will not give her her real name, but we call her Isabella. She is a Kenya registered nurse. Her case was just as serious. Her pain was such that she went wild. She went suicidal. She was aggressive when the periods came, and very violent. She actually had to be locked up in a room to control her behavior. And because of that, the doctors had tried to treat her endometriosis through surgery, but it had failed. In fact, after surgery, the pains had come even much stronger. So what they did was to pump her with medicines to completely stop her periods. And they succeeded. So at only 28 years, our patient, Isabella, was in menopause. And that is when we appeared. We treated her. In 1 month, she was okay. Her pelvic pains, her pressure, her headaches, all these were gone. But the only thing that had not come back was her menses. It took us 3 months to bring back her menses. But when they came back, the menses were normal. No pain, nothing. It took 3-4 days, just like the other normal women. Even as we talk now, Isabella is fine. I know some of you do not believe what I'm saying. I can't blame you. I know you have been cheated many times. You have been given wrong information and all that. But listen to this. Over the last 2 years, until this February 2026, we were giving free treatment to women with these problems. We have treated hundreds of them. What you need is to reach out to them There are many, they are still coming, many are on treatment. Talk to them, hear their stories, then you will be able to make your own decision. Now, the message is simple. These painful periods, long periods, heavy periods, painful periods, painful, perfect, and perfect with pressure, all these signs we have talked about, they are not normal. Do not be cheated. Do not be told that they are part of being a woman, that you should put up with them, that they are part of your imagination. No, they are real. But the thing is that they can be treated completely. You can walk free again, a free woman. Now, before I end, I want to give you a piece of advice to help you. There are 3 conditions that we refer to as opportunist diseases. 3 diseases that follow those with these conditions. They are nearly always there if you have that condition. These are yeast or candida infections. You can also have UTI infection. You can also have PID infection. This makes your condition even more difficult and even more painful. It also makes it difficult for the doctor to know, using symptoms and signs, to know whether you have also endometriosis or you simply have fibroids or yeasts. So my advice is this: go out and get tested for these diseases, that is yeast, UTI, PID. Get treated. If you want to come and see us, please get tested for this before and come and see us. My Endo warriors, my listeners, may God bless you. May God bless all of you. Thank you very much.